Okay, so today we're diving deep into the nervous system.
Yeah, think of it as a guided tour through your body's control center, the brain and nerves and all that.
Right. And specifically, we're looking at this from a medical surgical nursing perspective.
Yeah, we'll cover the basics like how it all works, the CNS, the PNS.
And then we'll get into what happens when things go wrong.
Exactly. Things like increased intracranial pressure, infections like meningitis,
Neuromuscular disorders, Alzheimer's, cranial nerve problems.
seizures, even brain tumors. A
Eh.
lot to cover, but we'll make it clear and hopefully even a bit surprising.
So to get us started, let's break down the nervous system. We have the CNS, which is the brain, and the spinal cord, the command center.
Right. The brain is further divided. You have the cerebrum, which handles your thoughts, the cerebellum for coordination and balance, and the brainstem, which controls all the essential stuff, breathing and heart rate and all that.
And then the spinal cord acts as this information highway, right?
Huh.
Sending messages back and forth between the brain and the rest of the body.
Exactly. And that's where the PNS, the peripheral nervous system, comes in. It's all the nerves that branch out from the CNS, reaching every corner of your body.
So it's like the CNS is the main office and the PNS is all the field agents.
Yeah, a perfect analogy. And within that network, you have different types of nerve cells with specialized roles. You've got sensory neurons.
Those are the ones that pick up information from the environment, like touch, temperature, pain.
Right, they're the ones sending signals to the CNS. Then you have the motor neurons. They carry instructions from the CNS.
So they tell your muscles to contract or your glands to secrete hormones, basically any action your body takes.
Exactly. It's a two-way communication system. And let's not forget the interneurons. They're kind of like the middlemen, relaying information between sensory and motor neurons within the CNS.
So they're processing the information, making sense of it all. Now, if we zoom in on an individual nerve cell, we've got the dendrites and the axon.
The dendrites are like branches reaching out from the cell body, receiving signals from other nerve cells.
And they transmit those signals toward the cell body, right?
Right. And the axon, it's a single long extension that carries the signal away from the cell body to other neurons, muscles, or glands. It transmits the message onward.
Okay, so dendrites bring information in, axons send it out. What about myelin? That word keeps popping up.
Ah, myelin is fascinating. It's a fatty substance that wraps around many axons. Think of it like insulation around an electrical wire.
So it helps the signal travel faster and more efficiently?
Exactly. Without myelin, those signals would be slow and weak, kind of like a dial-up internet connection.
Definitely not ideal. And that's why conditions that damage myelin, like MS, can cause so many problems.
Exactly. The signals just can't get through properly. Now, let's talk about those 12 cranial nerves. They're part of the PNS, but they originate directly from the brain.
And there's that mnemonic to remember them. On, they traveled and found Voldemort guarding very ancient Horcruxes.
A bit silly, but it works. Each word represents the first letter of a cranial nerve.
Okay, I can see how that would be helpful. Now, sometimes during neurological assessments, you might hear terms like decorticate posturing or decerebrate posturing, and also flaccidity. What do those mean?
So these are basically involuntary postures or positions that can give clues about where damage might be in the brain. Decorticate posturing, where the arms are flexed and held close to the body, often points to damage somewhere in the cerebral hemispheres.
And what about decerebrate posturing?
Well, in that one, the arms and legs are extended and rotated outwards, often more serious, usually indicating brainstem involvement.
And flaccidity?
Flaccidity is the absence of muscle tone, really limp, which again can signal a significant problem. These postures are really important clues when you're assessing someone's neurological status.
All right, now this next topic is something we hope no one ever has to deal with.
Yeah.
Increased intracranial pressure, or ICP. What exactly is happening there?
So picture this. Your brain lives inside a very rigid box, your skull, and the space is limited. Your body has these really intricate mechanisms for maintaining blood flow and oxygen to the brain tissue.
It's constantly adjusting, right? Constricting or dilating those blood vessels to keep things stable.
Exactly, like a finely tuned thermostat. But certain things can disrupt this delicate balance, and that's when the pressure inside the skull starts to rise. Think about the Monroe-Kelly doctrine, which basically says that the total volume inside the skull, the brain tissue, the blood, and the cerebrospinal fluid has to stay relatively constant.
So if one component increases, like swelling from an injury, something else has to decrease to compensate.
Right, otherwise the pressure builds up.
And what kind of things can cause this imbalance?
Well, lots of things, unfortunately. You can have growths, like brain tumors that take up space, swelling or bleeding after a head injury can also do it.
And certain infections, right, like meningitis or encephalitis.
Absolutely. Those can definitely cause inflammation and swelling. And the consequences of increased ICP can be really serious.
It can disrupt brain function, right, leading to all sorts of problems.
Yeah, it can cause problems with thinking, movement, even consciousness. It can be temporary or permanent, and in severe cases, it can even lead to death. The central nervous system is really vulnerable to these pressure changes.
So what are some of the early warning signs that someone might have increased ICP?
Well, you might see changes in behavior like drowsiness, restlessness, confusion.
Someone might seem unusually irritable or have personality changes.
Right, those can be early signs. And if they've been assessed using the Glasgow Coma Scale, you might see their score, which should normally be 15, dropping a little, maybe to 13 or
And
14.
the Glasgow Coma Scale, just to clarify, it's a way to measure how conscious and responsive someone is.
Yeah, the lower the score, the more concerning the situation is. Now, other signs might include sluggish pupils, maybe one pupil is bigger than the other. Weakness in the arms or legs can also be an early sign.
Slurred speech, a headache that's worse in the morning, especially upon waking up.
And vomiting without nausea, that can be a red flag too. Sometimes you'll even see an increase in blood pressure as the body tries to compensate.
Okay, so those are the early signs. What happens if the pressure continues to rise? What are some of the later, more severe signs?
Well, at that point, you might see a significant decrease in responsiveness. The person might become comatose, so their GCS would drop below 12, and they might not respond to pain.
And those abnormal postures we talked about earlier, those can become more pronounced.
Right. Decorticate or decerebrate posturing. You might also see increasing weakness on one side of the body, pupils that are dilated and don't react to light, and seizures can happen as well.
There's also something called Cushing's triad, right?
Yeah, that's a very late sign, and it involves a specific pattern of changes in vital signs. Initially, the pulse might be rapid, but then it slows down, the systolic blood pressure increases, and the breathing becomes irregular.
That sounds really serious.
It is. Other late signs include loss of reflexes, like the gag reflex or the corneal reflex, and periods where breathing stops, called apnea.
Now, the materials also mention pupillary changes, specifically that one pupil might be larger, and it mentions that this is due to compression of a cranial nerve. Do we know which cranial nerve is usually affected?
While it's not specifically stated in the excerpt, the most likely culprit is the oculomotor nerve. That's cranial nerve 3. It controls the muscles that constrict the pupil, so if there's pressure on that nerve, the pupil on that side might dilate.
Makes sense. And it also mentions a particular type of breathing pattern, Cheyne-Stokes respirations.
Right, that's a pattern where you have these cycles of deep, rapid breathing, followed by periods of apnea. It's another indicator of severe neurological problems.
So if someone is showing these kinds of signs, what diagnostic tools are used to figure out what's going on?
Well, they might start with a skull x-ray just to rule out any fractures or obvious abnormalities.
But they likely move on to more sophisticated imaging, right? Like CT scans or MRIs.
Exactly. Those can give much more detailed images of the brain, so you can see if there's bleeding, swelling, or maybe even a tumor.
They might also do a lumbar puncture or spinal tap to analyze the cerebrospinal fluid.
Right, but that has to be done very cautiously if there's a suspicion of increased ICP.
Because withdrawing fluid could potentially cause a dangerous shift in pressure within the skull.
Exactly. Cerebral angiography might also be done to look specifically at the blood vessels in the brain.
So once they figure out what's causing the increased ICP, how do they manage it medically? What are the goals?
The top priorities are to make sure there's enough blood flow to the brain and that the brain is getting enough oxygen.
So maintaining blood pressure is key.
Absolutely, and that often involves carefully choosing what fluids to give intravenously. They might use isotonic solutions like normal saline or lactated ringers.
And sometimes even hypertonic saline, right? To help draw fluid out of the brain tissue.
Right, but they generally avoid hypotonic solutions or solutions that contain glucose because those can make the swelling worse.
Corticosteroids are sometimes given too, right? To reduce inflammation.
Yes, they can help to stabilize the cell membranes in the brain and reduce swelling. Supplemental oxygen is also crucial to maintain good oxygen levels in the blood.
And in some cases, they might use hyperventilation, right? To temporarily constrict the blood vessels in the brain.
Yes, but that's usually a very short-term measure just to buy some time because it has its own risks.
Okay, so that's the medical management. What about nursing care? What does that typically involve?
Nursing care is really comprehensive. Positioning is really important. They'll usually elevate the head of the bed to about 30 degrees and keep the head in a midline position.
To help with drainage, right? Reduce pressure.
Exactly. They'll also try to minimize any stimulation, keep things calm and quiet.
So no loud noises or sudden movements.
Right, because those can increase pressure in the brain. Nurses are also constantly assessing the patient's neurological status.
Checking reflexes, monitoring for any changes in consciousness, things like that.
And they'll also be monitoring vital signs very frequently, especially in critical cases. Preventing seizures is another big part of nursing care.
So they might give medications like diazepam or phenytoin to control seizures.
Yes, and if the patient is agitated, they might use sedation to keep them calm because agitation can actually increase ICP.
And sometimes they'll need more invasive interventions, right? Like a catheter or a feeding tube.
Yeah, those might be necessary, especially if the patient is not fully conscious or able to swallow safely.
And then there's also surgical management, right? If those medical interventions aren't enough.
Yes, surgeons might insert an ICP monitor, which allows them to directly measure the pressure inside the skull.
And that gives them real-time feedback, right? So they could adjust treatment as needed.
Exactly. And sometimes surgery is needed to remove a blood clot or a tumor if that's what's causing the increased pressure.
Now, the materials also mention hydrocephalus. What exactly is that, and how does it relate to ICP?
Hydrocephalus is a condition where there's too much cerebrospinal fluid, or CSF, in the brain. It can happen if the brain produces too much CSF, but more commonly, it's because there's a blockage preventing the normal flow of CSF or a problem with its absorption.
So the CSF builds up, and that increases the pressure inside the skull.
Right, it's kind of like a plumbing problem in the brain. The blockage can be caused by tumors, trauma. Sometimes it's even a congenital defect.
And the symptoms of hydrocephalus can mimic those of increased ICP, right?
Yeah, you might see vomiting, irritability, seizures, but you might also see problems with balance and coordination, excessive sleepiness, even personality changes, especially in older adults.
In babies, you might see a noticeable increase in head size.
Right, because the skull bones haven't fully fused yet, so they can expand to accommodate the extra fluid.
And how do they treat hydrocephalus?
Well, if it's caused by a blockage, they'll often surgically insert a shunt to drain the excess CSF.
Basically a tube that redirects the fluid.
Exactly. If the blockage is caused by a tumor, they might try to surgically remove the tumor.
Okay, so let's move on to infectious and inflammatory disorders, starting with meningitis. What's the basic problem in meningitis?
Meningitis is an inflammation of the meninges, those protective membranes that surround the brain and spinal cord.
So we're talking about the dura mater, the arachnoid mater, and the pia mater.
Exactly. And this inflammation can be caused by a number of things: bacteria, viruses, even fungi or parasites.
Bacterial meningitis is usually the most serious, right?
It tends to progress more rapidly and can be life-threatening.
What are the typical signs and symptoms that someone might have meningitis?
The classic signs are a severe headache, a high fever, and stiff neck.
That stiff neck, it's called neutral rigidity, right?
Right. It's very difficult to bend the head forward because the muscles are so stiff. You might also see nausea, vomiting, sensitivity to light.
Restlessness, irritability, maybe even delirium or seizures.
And there are a couple of specific signs they look for during the physical exam. Brudzinski's sign, where flexing the neck causes the hips and knees to bend involuntarily, and Kernig's sign, where straightening the leg when the hip is flexed causes pain and resistance.
It seems like there's a lot of overlap between the signs of meningitis and increased ICP.
There is, and that's because the inflammation in meningitis often does lead to increased pressure inside the skull. So you might see some of those same signs like hypertension, a slow heart rate, and slow breathing.
Which seems counterintuitive, right? Because you'd usually expect rapid breathing and a fast heart rate with an infection.
Right, but in this case, it's more about the pressure on the brainstem affecting those vital functions. Now, it's important to note that the symptoms can vary a bit depending on the cause of the meningitis.
So bacterial meningitis, viral meningitis, they might present a little differently.
Yeah, for example, meningococcal meningitis, which is a particularly serious type caused by a bacteria called Neisseria meningitidis, can sometimes cause blood clotting problems and a rash.
Petechiae, those tiny red or purple spots.
Right, those can be a sign of meningococcal meningitis. Viral meningitis might also cause a rash, but it's usually more of a blotchy maculopapular rash.
And older adults might have more subtle symptoms, right?
Yeah, they might not have the classic high fever and stiff neck. They might just seem confused or have a slight fever, which can make it harder to diagnose quickly.
And babies can be tricky too, right?
Yeah, they might have jerky movements, a high-pitched cry. They might be irritable or stiff. So it's always important to be aware of the different ways meningitis can present.
Absolutely. So how do they diagnose meningitis?
The gold standard is a lumbar puncture or spinal tap, where they collect a sample of cerebrospinal fluid.
And they'll analyze that fluid, right? Look for bacteria, viruses, anything unusual.
Exactly. They'll do a culture to see if anything grows, and they'll check for white blood cells and protein, which can indicate inflammation. They might also do a CT scan before the lumbar puncture.
Just to make sure there's not a lot of pressure inside the skull,
Yeah.
which could make the lumbar puncture dangerous.
Right, it's a precaution to avoid complications. They might also do a blood culture to see if the infection is in the bloodstream.
Okay, so once they diagnose meningitis, how do they treat it?
Well, the main goals are to control the infection, reduce inflammation, and manage symptoms. So they'll usually start intravenous antibiotics right away if they suspect bacterial meningitis.
And if it's viral, they'll focus on supportive care.
Yeah, things like fluids, rest, medications to control fever and pain. They'll also carefully monitor for any signs of complications like increased ICP. And of course, there are vaccines to prevent some types of meningitis, like the meningococcal vaccine and the Hab vaccine.
So vaccination is really important for prevention.
It is. And if someone is diagnosed with meningococcal meningitis, they'll need to be isolated to prevent spreading the infection. And people who have been in close contact with them might need to take antibiotics as a precaution.
Okay, now let's talk about encephalitis. How is that different from meningitis?
Well, while meningitis is an inflammation of the membranes surrounding the brain and spinal cord, encephalitis is an inflammation of the brain tissue itself.
So it's a deeper infection.
In a way, yes, it affects the parenchyma, the functional tissue of the brain, and it can cause damage to those brain cells, leading to swelling, bleeding, even cell death.
And what are the common causes of encephalitis?
Often it's caused by viruses, especially those spread by mosquitoes or ticks.
Like West Nile virus or Eastern equine encephalitis?
Exactly. It can also be caused by the measles virus, and in rare cases, there's been a link to certain vaccines.
The MMR vaccine.
Right, but it's extremely rare.
So what are the signs and symptoms of encephalitis?
Well, they can be pretty similar to meningitis, actually. Headache, fever, stiff neck.
But you're more likely to see neurological problems with encephalitis, right?
Exactly. You might see drowsiness, confusion, seizures, even paralysis, and the symptoms can come on suddenly.
How do they diagnose encephalitis?
They'll often do a lumbar puncture to analyze the CSF.
But unlike meningitis, the fluid is usually clear in encephalitis, right?
Yeah, that's one way to differentiate them. They'll also do brain imaging like MRI or CT to look for specific patterns of inflammation in the brain.
And they might do an EEG, an electroencephalogram, to measure brain waves.
Right, that can show abnormalities consistent with encephalitis.
And what about treatment?
If it's caused by a virus, they might give antiviral medications.
Like a cyclover for herpes simplex virus.
Exactly. But a lot of the treatment is supportive, controlling fever, preventing seizures, managing any other symptoms.
And of course, preventing mosquito and tick bites is really important.
Absolutely. Wearing insect repellent, covering up when you're outdoors, things like that can make a big difference.
Okay, let's move on to neuromuscular disorders, starting with Guillain-Barré syndrome, often shortened to GBS. What's the underlying problem there?
GBS is an autoimmune disorder, which means the body's immune system is attacking its own tissues.
And in this case, it's attacking the myelin sheath, right? That protective covering around the nerves.
Exactly. It causes inflammation and damage to the peripheral nerves, the ones outside the brain and spinal cord.
And that disruption of the myelin sheath can lead to weakness and paralysis.
Right. The signals can't travel properly along the nerves.
What causes GBS?
We don't know for sure, but it often seems to follow a viral or bacterial infection.
Like a respiratory infection or the flu?
Right, something like that. It's also been linked to certain vaccines, but again, very rarely.
So what are the symptoms of GBS?
The hallmark is progressive weakness, often starting in the legs and moving upwards.
Ascending paralysis, they call it.
Right. People might also experience numbness or tingling in their extremities.
And sometimes the cranial nerves can be affected too, right?
Yeah, leading to problems with chewing, talking, swallowing.
And breathing, right. That could be really serious.
Yeah, if the muscles that control breathing are affected, it can be life-threatening.
So how do they diagnose GBS?
A lumbar puncture can be helpful. They'll look for elevated protein levels in the CSF.
And they might do nerve conduction studies to see how well the nerves are transmitting signals.
Exactly.
And how do they treat it?
A couple of main treatments. One is plasmapheresis, which is kind of like dialysis.
They filter the blood, right?
Yeah, they remove the harmful antibodies from the blood. The other treatment is intravenous immunoglobulin, or IVIG.
Which basically gives them a boost of healthy antibodies.
Right. And nursing care is really important for GBS, especially for patients who have breathing problems.
They'll need close monitoring, maybe even mechanical ventilation.
Yeah, and they might need help with other things like eating, bathing, going to the bathroom.
Okay, now let's talk about multiple sclerosis, or MS. This is another autoimmune disorder, right?
It is, but unlike GBS, MS primarily affects the central nervous system, the brain, and spinal cord.
And again, it's the myelin sheath that's under attack, right?
Right, but the damage is more permanent in MS. It leads to these hardened patches or plaques in the brain and spinal cord.
And that disrupts the nerve signals, causing all sorts of problems.
Exactly. The symptoms of MS can be really diverse because it can affect any part of the CNS.
So you might see visual problems like blurred vision or double vision,
Right. You might see weakness, numbness, tingling, problems with coordination.
tremors, difficulty speaking, even cognitive problems.
Yeah, it really depends on where the damage is in the brain and spinal cord.
And MS typically starts in young adulthood, right?
Yeah, somewhere between 20 and 40 years old. The exact cause is unknown, but it's likely a combination of genes and environment.
So someone might be genetically predisposed, but something in the environment triggers it.
That's the idea.
How do they diagnose MS?
MRI is really important. It can show those characteristic lesions in the brain and spinal cord.
And a lumbar puncture can also be helpful, right?
Yes, they'll look for specific proteins in the CSF. There are also special tests that measure nerve conduction.
Like evoked potentials.
Right. And unfortunately, there's no cure for MS, but there are treatments to manage symptoms and slow progression.
Corticosteroids are often used during flare-ups, right?
Yeah, to reduce inflammation. And there are medications that can help to modify the course of the disease, slow it down.
And what about nursing care?
Nurses play a big role in helping people with MS manage their symptoms and maintain their independence.
So they might teach them about energy conservation, ways to adapt to their limitations.
They might help them with bladder and bowel training, skin care, positioning, all sorts of things.
Okay, let's move on to myasthenia gravis, another autoimmune disorder. What's happening there?
Myasthenia gravis affects the neuromuscular junction. That's the connection between a nerve and a muscle.
And the immune system is attacking those
Yes.
connections, right?
Exactly. It disrupts the transmission of signals from the nerve to the muscle, leading to muscle weakness.
And this weakness gets worse with activity and improves with rest.
Right, it's a fluctuating weakness.
So what are the typical symptoms?
Well, it often starts with the muscles of the eyes and face. You might see drooping eyelids, double vision, difficulty swallowing.
And as it progresses, it can affect the limbs too, right?
Yes, making it hard to walk, lift things, even breathe.
And there's a risk of a myasthenic crisis, which is a medical emergency.
Right, that's when the weakness becomes so severe that it affects the breathing muscles, and the person needs mechanical ventilation.
So how do they diagnose myasthenia gravis?
There's a specific test called the tensilon test, where they inject a drug that temporarily improves muscle strength if the person has myasthenia gravis.
And they can also test for the antibodies that are attacking the neuromuscular junction.
Right. And what about treatment? There are medications that can help to improve muscle strength, and sometimes they'll remove the thymus gland, which is part of the immune system.
And again, nursing care is really important, right?
Absolutely. Nurses help people with myasthenia gravis manage the medications, plan rest periods, and adapt to their limitations. They also need to be able to recognize the signs of a myasthenic crisis and know what to do in an emergency.
Okay, now let's talk about a really challenging disorder. Amyotrophic lateral sclerosis, or ALS, also known as Lou Gehrig's disease.
This one is a tough one. It's a progressive neurodegenerative disease, meaning it gets worse over time and eventually leads to death.
And it affects the motor neurons, right? Those nerve cells that control movement.
Exactly. They degenerate and die, which leads to muscle weakness and wasting.
And eventually, paralysis.
Right. It often starts in the limbs, but eventually it can affect the muscles involved in breathing, speaking, swallowing.
And unfortunately, there's no cure for ALS.
No, not yet. There are some medications that can slow the progression slightly, and there's a lot of research going on, but there's no way to stop it or reverse it.
So what are the symptoms?
Early on, it might just be some muscle twitching or cramping, some clumsiness.
But as it progresses, the weakness becomes more noticeable.
Right. People might start having trouble with things like buttoning clothes, walking, holding things.
And their speech might become slurred. They might have trouble swallowing.
Eventually, they'll need help with all of their basic needs.
And one of the most heartbreaking things about ALS is that it doesn't affect the mind.
That's right. People with ALS remain fully aware of what's happening to them, even as their body fails them.
So how do they diagnose ALS?
It can be tricky because there's no one specific test. It's often a diagnosis of exclusion, meaning they have to rule out other possible causes of the symptoms.
They might do nerve conduction studies, electromyography.
Right, those can show abnormalities consistent with ALS.
And what about treatment?
The focus is really on symptom management, making the person as comfortable as possible.
So they might use medications to control muscle spasms, help with drooling, things like that.
Right, and they'll focus on maintaining nutrition and hydration, preventing complications like bed sores and pneumonia.
And supporting the person and their family emotionally.
Absolutely, it's a very difficult journey.
Now let's shift gears to a different kind of neurological disorder. Alzheimer's disease. This is the most common cause of dementia, right?
It is. It's a progressive brain disorder that affects memory, thinking, and behavior.
And it's those amyloid plaques and tau tangles that are the hallmark, right?
Right, they're abnormal protein deposits that build up in the brain and interfere with the normal function of neurons.
They disrupt communication between brain cells, and eventually those cells die.
And the brain actually shrinks, especially in the areas involved in memory and learning.
The hippocampus and the entorhinal cortex.
Exactly. And what's really scary is that these changes can start happening years, even decades, before symptoms appear.
So someone could have Alzheimer's developing in their brain without even knowing it.
That's right.
And the global impact of Alzheimer's is huge, right?
It is. It's estimated that over 50 million people worldwide are living with dementia, and that number is only going to increase as the population ages.
It's a major public health challenge.
Absolutely. And there's still so much we don't know about it.
We do know that certain things can increase the risk, right? Like age, family history, genetics.
Right. But there are also things you can do to potentially lower your risk.
Like exercise, staying mentally active, eating a healthy diet.
Yeah, those things are good for brain health in general.
So what are the symptoms of Alzheimer's?
Well, it typically starts with forgetfulness, trouble remembering recent events or conversations.
But as it progresses, the memory loss becomes more severe.
Right. People might start forgetting familiar faces, getting lost in familiar places, having trouble with language.
They might have personality changes, mood swings, become more withdrawn.
Eventually, they need help with all of their basic needs: bathing, dressing, eating.
And sadly, it's a progressive disease, meaning it gets worse over time, and eventually it leads to death.
It does.
How do they diagnose Alzheimer's?
Well, there's no one specific test. It's often a diagnosis of exclusion, meaning they have to rule out other possible causes of the symptoms.
They'll do a cognitive assessment, maybe a brain scan.
Right, and they'll look for a pattern of decline over time.
And what about treatment?
There are some medications that can temporarily slow the progression of the disease, but there's no cure.
So the focus is really on managing symptoms and providing support.
Right. Nurses play a big role in caring for people with Alzheimer's, helping them maintain their dignity and quality of life for as long as possible.
Now let's dive into cranial nerve disorders, starting with trigeminal neuralgia.
Also called nectic doularo. This one is all about pain.
Excruciating pain.
Yeah, sharp stabbing pain in the face.
And it's caused by a problem with the trigeminal nerve, right?
Right, cranial nerve number 5. It's responsible for sensation in the face.
So the pain can be triggered by the slightest touch, even a breeze.
Yeah, things like brushing your teeth, washing your face, even eating can set it off.
It's often described as the worst pain imaginable.
It can be debilitating.
How do they diagnose trigeminal neuralgia?
It's mostly based on the symptoms, but they might do scans to rule out other causes of facial pain, like a tumor.
And what about treatment?
There are medications that can help to control the pain, anticonvulsants, sometimes antidepressants.
And in some cases, they might do surgery to decompress the nerve.
Right, if medications aren't enough.
Okay, next up is Bell's palsy.
This one is a bit different. It's a sudden weakness or paralysis of the muscles on one side of the face.
So one side of the face might droop, the eye might not close properly.
Right, and it's caused by inflammation of the facial nerve, cranial nerve 7.
And it's often temporary, right?
Yeah, most people recover completely within a few weeks or months.
But it can be pretty scary while it's happening.
Definitely. It can be hard to talk, eat, even smile.
What causes Bell's palsy?
We don't know for.